right. That looks okay for everyone. Give me a thumbs up, Holly, Yona. Perfect. So just as an overview, we've been monitoring the mental health of staff in the sector since the start of the pandemic in June 2020. So wanted to just quickly show you that we've done a number of phases of this research, which has been a survey, first off to frontline staff in June of 2020, and then we've been doing it every year since. And then we added in when we realized, hearing from staff, that leaders were, and people in senior management, HR roles were also quite stressed. We started to do this survey for leaders as well. So we started in December, and then we had both leaders and frontline staff in June. So this kind of update of the stories of where we are, we'll do a little bit of a where we've been, but mostly focused on what we've been learning this past summer from 805 DSPs and 258 people in leadership positions. If we're not going to be able to cover everything this morning, but we did want to point you in the direction of where some of the research findings are in a really nice kind of in reports over the course of the year. So that link at the bottom will bring you to all of these four reports on both DSPs and leaders. So where are we now? We wanted to just kind of set the context, kind of what we've been through the last couple of years. So in 2020, when we first started polling staff on how we're doing, 5% of DSPs had supported clients with COVID. And in 2020, 10% of staff worked with staff with COVID. And as you see, it's drastically risen in this summer, almost all of the workforce worked with staff with COVID. So 93% and 69% supported clients with COVID. And then we also, less prevalent, but almost 20% of staff supported clients hospitalized with COVID. And again, wonderful to hear, but less, 7% supported clients who died from COVID. So not necessarily seeing a lot of deaths, but lots of interaction with the healthcare system. And we added this important thing at the end, about 62% of staff supported clients being hospitalized for other reasons, and 36% of supported people who died from other causes. And we think that this is an important thing to kind of just remember as a community, in that we've all experienced kind of collective trauma, lots of intersections with the healthcare system, helping our people that we support access the healthcare system. And sometimes this has resulted in grief and loss. So we've been hearing from staff firsthand in the stories that people have come to mindfulness and to our community of practice, just this shared trauma that people are experiencing. And it's actually coming across empirically in the data. So what are we learning about mental health? And I think this shouldn't be a surprise probably to anybody in the room, but just conceptually, like I think we all can understand that the people that we support, their mental health is impacted by the staff's mental health, and the leaders' mental health, and we all, as a community, are impacted, and it's a relationship, right? And we know this kind of conceptually, how we are all connected. If our people who supported are sick, or if we are sick, our staffing team is sick, or we don't have the leadership because they're off sick or stressed, it all has an effect. And we actually can see it empirically in some of the data that we're collecting. So I'm wondering, I'll just give you a brief quote of something we heard from one of the staff and seeing if it kind of lands or how it resonates with you. And the key part is that one of the things that we bolded is that my mental health has never been as bad as it has been lately. They talked about how their job consumes me and also how their job, they can't afford to live outside of work. They've had to cancel appointments for their own self-care because of lack of staffing. And they've gone on to say the impact on their life, having missing out on too many birthdays, holidays, because of having to stay at work or choosing to stay at work because shifts aren't able to be filled. And we've heard this, for the last couple of years, and it certainly has been exacerbated by the pandemic. But this lack of staffing, and then the people that are there, staying because they really care about their clients, but it having an impact on their lives. And a further quote, staff are sick and tired of wearing masks for 8 hours a day, very negative, and having a hard time motivating myself at work. And such an important insight to know this is what I'm feeling. I look at and see the residents that we've lost and wonder if they still would be here if they've had regular activities and something to look forward to. So the loss and the stress that staff are feeling, certainly there's also observing in the people that they support. And I'll actually shift this over to Yona, because we are collecting information on what staff are seeing about people's supported health.
Thanks, Nicole. So again, a lot of this is in some of the reports that we've linked to. We're kind of glossing through stuff, even though they're all very heavy topics and we could speak about it for several hours. We just want to get a few key points across to people, recognizing you all have just a little bit of time right now. What this first bar graph here shows us, the top bars are what we're seeing now. The bottom bars are what we were seeing 2 years ago. And you see that in terms of aggression, mental health, and physical health issues, they're all being reported as more common now than what we were seeing at the beginning of the pandemic. Next slide. And in this slide, we're looking at how staff are reporting on their own mental health. And what we see here is 1 in 4 staff reported moderate to severe distress in that first summer of the pandemic, but it went up to over 1 in 3 staff, and it stayed up there this summer. Next slide. When we look at the key concerns of staff now, just wanted to highlight a few nuances or differences. So we aren't seeing staff quite as afraid as they were when nobody had had COVID yet. And we're also seeing that staff are engaging more with their friends and families and hobbies than maybe they were earlier on. How they feel about IPAC. IPAC is still an issue, but it's shifted in terms of what the issues are. And this sort of heavy sense of that moral distress that Nicole spoke about before is really evident. But what's really actually the same as what we saw before has to do with still being afraid of giving people COVID, especially the people they're supporting, concerns about client mental health, gaps in services, concerns just about pay and other aspects of their job, benefits, hours, sick time, and then just big sense of burnout. And the other point is that staff don't all agree on sort of where they're at right now. So they're very strong opinions, but different opinions from different staff. And I think that's really important when we think about solutions. Next slide. So just highlighting here, when we ask staff, each time we give the survey, we ask them what would be most supportive to them. And I wanted to highlight the 2 things that shifted. So extra staff coverage has always been an issue, but it went up in terms of what would be the most helpful thing this time around. And also the issue, as I mentioned before, about being able to see family and friends, that would be the most helpful thing. It was right up there a year ago and 2 years ago. It's still there, but it's not as prominent as it was. And I think that's because people are managing to figure out how to do that. Next slide. This is just reminding us, I know some of the people on the call are in leadership positions. We wanted to flag that this issue of moderate to severe psychological distress that people are experiencing is not just for staff in the sector on the front line. It's also happening to leaders who are working in the sector. So what we see here is that 6 months before the last survey, so I guess about a year ago actually, about 30% of leadership reported moderate to severe distress, and those percentages were about the same when we asked them about it this summer. So it hasn't gone down either for leadership. Next slide. So I think I'm doing 2 more slides and then it's back to Nicole. So just to highlight here, and I'm not going to go through every bullet, we're also hearing from leadership that things are difficult, right? It's not just for the frontline staff, and that staff or leaders are really concerned about this issue of staffing. It sort of permeates everything else. And this issue of sort of burnout and also the workload and just how much information has to be digested, translated, shared and sort of the constancy of it is quite exhausting. Next slide. So here's some quotes from leadership, and it's just sort of highlighting here, frustrated by the ever-changing direction. It's hard enough, I think, to have bad news to deliver, but confusing bad news or changing bad news and lots of nuances is really, really hard to absorb and keep sharing. And then the second quote is really focused on what's happening around the staff shortages and how lonely I think it can feel when you're in these leadership roles trying to deliver when there's just so much unknown and so much risk. Next slide. So this is just a slide, whether it's for leaders or for the DSPs, I think the issues were pretty similar. And that is that when people do need mental health services, it's really difficult to have the time to do it. The waits for the right kinds of service can be very long, or sometimes people can go to use a service like the EAP, and it's either too complicated or it's not what people feel like they need. So like you finally decide, okay, yes, I need help. Yes, I'm going to get help. And you go and do that, and it doesn't actually work out the way you want it to. And that's really harmful, I think, for people. So I'm going to turn things back to Nicole.
So what we've done this morning, or wanted to start the conversation this morning, was to really just provide a snapshot, and happy to have a longer discussion with you and help see if this information can help you with the organizational mental health within your community, and some of the things that we are learning and want to feed back to you is that these are really complex issues. You know, a critical staffing crisis, trauma, grief, loss, navigating this new normal. We're in uncharted waters, and it does take the expertise of our entire community. So lots of times we try as organizations, I think, to kind of manage but I don't think we necessarily need to recreate the wheel. I think sharing the resources, and we'll talk about that in a second in terms of solutions. I do think what we're seeing is that poor mental health and stress in the workplace is not going away. So chronic stress is here, and it is impacting people's mental health, their ability to want to stay, ability to just like financially, sustainably stay in their roles in the sector. So from a recruitment and a retention, we really want to be looking at this, and everyone is impacted. And also just like a note to that, when we look at interventions, what sorts of things help, there are challenges accessing community mental health supports. And maybe something to look at within your own organization is how accessible and how are people finding their EAP if they have access to it within the organization. If you don't, what kinds of resources are you kind of directing people to? And I think that can be a really challenging thing, is to curate and know where to send people or where to point them in the right direction. So in terms of recommendations from this work, I think one of the things that is by far at the front is recognizing the really essential nature of the work we do in the sector and the stress involved in working in this new normal. And we really need to continue to support mental health, invest in targeted, so things that are relevant to what we experience in the sector, accessible mental health promotion interventions. We need to look at how do we build capacity of organizations, how do we continue to have a conversation about mental health, looking at investing in accessible training for people coming into the sector, and also for professional development for leaders in terms of mental health training. And I think continuing to learn from staff. So, having conversations, learning from each other, what sorts of things are working, what didn't work so well, how can we build our community capacity and community knowledge about how to tackle this so that we are all at whatever position and role we have within this community, we're kind of supporting our mental health. So with a couple of minutes left, and then we'll open up for questions, I just wanted to do a little bit of a plug for Cultivating Community Wellness. And it is a provincial network kind of led in collaboration with CAMH initiative. So we have a number of things that we are trying to kind of initiate and run and continue this conversation on. So I would direct you to the website, so the provincialnetwork.ca.cc wellness. But there are 4 kind of things that we're targeting in this first couple of years. One, community of practice monthly meetings, building some tools and resources that are kind of relevant and helpful for our community, hosting monthly webinars of things that staff want to learn, and ECHO training. So if anyone's ever heard of ECHO training, I'm happy to talk about it more, but it's a kind of provincial-led model where people from healthcare and also people from developmental service kind of come on and talk about complex and challenging cases. And then we all kind of teach and all learn in that kind of model. So happy, again, Yona can talk further, and or I, if that's an interest to people. But one of the other things, if I can, yeah. Okay, so we just had our launched our community of practices for the fall, and I wanted to just give a plug for 2 ones that are coming up in January. So the one is focus on fostering our mental health in DS organizations. So these are mainly, I think the mandate is around kind of fostering mental health in organizations. So lots of members come from wellness committees, people that want to look at how do we change our workplace. That's on January 18th, and the link is there, and we'll send the slides. And then the community of practices fostering our own mental health. I would just encourage any staff who wants to come. We start with a mindfulness kind of exercise with Sue Hutton, and then we talk about things that are directly impacting us in our own work. So don't have necessarily our organization hats on. And that's on January 25th and in the evening, which will rotate times depending on what works for folks. I'll also share a couple other events. So mindfulness for care providers, so DSPs, I would encourage you. Sue is amazing. She's leading both of these events. They're 6 weeks drop-in sessions, both for people in leadership and management positions and for care providers. And then there's also, we're running in the new year, it's called PAC, so Promotion of Acceptance in Carers and Teachers, or Acceptance and Commitment Therapy. Sorry, that was a bit of a mouthful, but Acceptance and Commitment Therapy Training for carers and teachers will run in the new year. And like I said, there is one also for leaders and managers, and a group for kind of frontline DSPs. There are also a number of resources coping with COVID. You're welcome to join. The particular ECHO we are running, and I'll show you on the next slide, we have one coming up in January, focused particularly on autism. And then there are mental health services for frontline staff. So staff can just go on their own accord, and it will direct you to accessing some mental health resources there. So like I said before, sometimes it's just about finding these things and knowing that they're out there. So this is an information about our upcoming ECHO for really focused on building capacity around supporting people with autism, autistic adults, starting in January. And then we wanted to include, for people that are coming here with a more organizational, let's build a culture of mental health in our workplace lens. We have a couple of resources here that may be of help, and we'll bring forward in our community of practice, but wanted to have for you here. So I think in light of time, I'm sorry, I went on a little bit too long, but just stop and see if there's any questions that we can answer while we're together today.